The National Health Insurance Bill remains a hot topic. The bill aims to extend quality health care to all South Africans. Government wants to use the NHI as a financing mechanism to provide affordable health care for all South Africans. For now, only those on medical schemes enjoy access to quality health services. But with the ailing public health infrastructure, there are concerns that government is not ready to implement the bill. Health Minister Dr. Phaahla formed part of the BBC summit discussions. He was at pains to explain why government is pushing for the bill to be signed into law 30 years on.
Over the last 30 years, while we build a resilient public health system, which has also been able to carry us during the COVID, we have also facilitated a divided health system. But what this has then led to is highly fragmented system, which has led to a lot of inequity, as the program director has indicated, and it now it had to bring us back to our commitment that we must have equity.
The BBC has gathered members of the business community, professionals and government on a variety of issues affecting the country's economy and businesses 30 years into democracy. Those at the summit raised concerns about the NHI Bill.
We have a Minister of Health that must then deal with the health issues in the country in terms of how do we deal with a health system that accommodates everybody in the country.
What is required, when is it going to happen, how is it going to happen? And I think it's not even just about impact on industry as a whole or the people gathered here. It's about the impact on you and I. It's about the impact on the person who is at home. How is this going to impact? How are they going to have to pay? How am I going to have to pay? If I've got medical aid, what does this actually mean?
Considering that majority of South Africans rely on government health system, we're hoping that such initiatives will bring that into parallel so that everyone has equal care to health care. Not only that, I think from a disability point of view, NHI will go a long way.
But the minister also took some time to allay concerns raised around the modalities of the bill. He says it will be rolled out in 2 phases with a board that will be constituted to oversee the process.
I believe that that philosophy will remain even under the NHI in terms of supporting local economic development and making sure that it boosts employment and so on. The main thing will be in terms of the detail. I'm in court already with some of your colleagues on this matter. The issue there is that there are certain insurance companies which are having products which are not medical schemes, but which cover certain aspects of medical treatment like hospitalization and so on. There are different options and they are limited of cover. So somebody believes I've got cover, but the day when they really need something, they realize it doesn't really cover what they need now. So those are the difficulties which we're facing. So we're busy with BHF and others with CMS looking at what are the ways.
The gathering also featured discussions on South Africa's economy 30 years on, the broad-based BEE policy and the just energy transition. The minister saying the president is well within his right to take his time, as he can either sign the bill into law or ask lawmakers to amend it if it's deemed to be legally or technically flawed. Consultations also continue with those in the sector, the minister allaying concerns as he indicates that the intention remains to transform the country's healthcare sector 30 years into democracy. Katlego Legodi, SABC News in Kempton Park.